has a master's in physical therapy, and I believe a doctor in physical therapy now as well, which most physical therapies we are requiring in the state of Florida have a doctor of physical therapy. So we're really pleased to have that level of education. It's a lot of years of education, right, Liz?
Yes. Yes. Thank you all so much, first of all, for having me here this morning. It's really wonderful to get to do these events where we actually get to see folks from the community and some of the impact that we can hopefully make in a positive way here. So thank you also for the introduction. I've been down in Florida here for about 10 years and would not go back to the snow. So just to get that out of the way, everybody asks if I miss it, and I don't. Just a quick, I wasn't sure what level of information everyone would need today, and I think we have kind of lots of different levels of folks in the room today. So I'll kind of just briefly go through this. As you all know, Parkinson's is a progressive disease that causes some muscle control loss, which in physical therapy world, where we like to consider ourselves some of the musculoskeletal experts, that's a big red flag for us of an area that we really want to help people out when they're affected by that. Some of the fun stuff behind it, basically it affects an area in the brainstem that releases dopamine, and it decreases that dopamine production and thus does not communicate effectively for movement throughout the body. Diagnosis is often difficult and kind of a diagnosis of exclusion a lot of times. Your doctor probably went through a thorough exam, testing, but some of the hallmarks that they look for are that tremor. You all know a tremor at rest as opposed to intention, and sort of has a specific beat to it, a rhythm to it, and rigidity as well as balance disturbances, which again is an area for physical therapy that we really believe we can help and have an impact on, because balance is such an important facet that really affects all of your day-to-day activities and your independence level. In general, it affects more men than women, about one and a half times more men than women, and is usually onset after about 60. Not always the case. Everybody knows Michael J. Fox, of course, younger faced the diagnosis, but those are just the averages. And I talk fast, so feel free to raise your hand and interrupt me too with questions. I don't mind that. How can therapy help? First and foremost, exercise allows the brain to use dopamine more effectively. That's just a fact, and considering that this is a progressive area where dopamine is affected, we really want to keep you moving and keep you active to keep those receptors responsive to the dopamine and keep as much normal movement as we can. Exercise also assists in improving balance and coordination. You see all these, even athletes today are constantly working on agility and balance, from your soccer and tennis players to football, everything, because you have to practice and you have to continue honing those skills in order to retain them. And that goes from the high-level athletes to people such as myself who sit at a desk a little more these days. It's also been shown that those who remain more active have a slower progression of the disease process and are able to maintain their independence longer, which is, to me, a really big factor. Most people with Parkinson's disease still have the same life expectancy, especially when they're diagnosed in their 60s or 70s. And you want to maintain your independence and your function as long as you can, and avoid going towards some of the assistive devices and different things. What will therapy address if you get sent to a physical therapist? I know sometimes it can be scary and you're thinking, oh, they're going to make me run or they're going to twist me like a pretzel. We're not out to hurt anybody. The main things that we want to address for these patient populations are your balance, to prevent falls specifically, your gait, to improve your mobility and, again, decrease risk of falls, your flexibility, to keep you moving through full ranges of motion, strengthening, which is something I'll talk about as we go through the slides, but used to be sort of counterindicated in many of these populations, but we're now finding that strengthening is vital for your muscles. Strategies against freezing, and there's other recommendations your therapists may make. So going through some of these. Therapy for balance. This to me, I put number one because I feel like balance affects everything we do. And of course, risk of falls is one of the number one things in all populations that can lead to other problems. You know, once you've had a fall, you often get that fear of doing things because you're afraid of falling again, afraid of, you know, my mother has osteoporosis, so she started changing her whole lifestyle because she was afraid of breaking a hip. And I'm like, well, if you don't do anything, you're going to continue to lose bone density, and then when you do fall, yes, you are going to break a hip. So you need to stay active to avoid that. So it's a little bit of a mindset change. But our Parkinson's population is often a little bit more at risk, especially as it progresses. They often kind of assume a more stooping posture, which right away you can see my center of gravity is thrown off because my weight is now forward ahead of me. And as soon as I trip or stumble on something, I'm going to go over. So we very much look at posture in these patients and try and make sure they're maintaining as best posture as they can. We look at their gait, which we'll talk about, to make sure they're picking up their feet and not at risk of stumbling on uneven ground. Many programs, like Fyzical, my wonderful program, has a lot of specialized training for balance. There's a new market that's been developed very much in recent years with a lot of sort of biofeedback or videotaping of things. Many people have heard of WeFit and the Connect, probably that I'm really excited to see today, actually. Not try and push or pull them and help them along because that can exacerbate the possibility of a fall. You want to just be encouraging, be there, and help them get to that spot when they're ready. As soon as you push or pull, you don't want to cause them to fall. So that's, you know, we always want to be helpful, but we want to be helpful in the right way. Am I doing okay for time? I'm talking really fast. And again, many facilities should have specialized equipment. Our particular facility, we have an underwater treadmill, which is fantastic because it allows you to work on the gait. It has the video feedback so you can see that you're lifting your feet, how far you're lifting. And in the water, with the buoyancy, there's not the risk of fall. I mean, you're not going to crash down. You're going to be supported by the water, which is really nice and safe. There's this isn't our specific underwater treadmill, but it's one of the good pictures that I could get. Therapy for flexibility. Again, over time, many of these patients start to become very rigid just by not moving as much through all of their range of motions as they start deteriorating that muscle control. Your therapist should, as part of your home program, give you a good stretching program or give a good program that your caregiver can help you through with stretching. Therapy for strengthening. Again, muscle weakens when not used. So when you are sedentary, which a lot of times happens, again, when we get that fear of falling or we feel like, oh, I can't move as fast as I used to, we become less active. And the less active you are, the quicker that muscle deterioration sets in. And again, when we're thinking about those neurochemicals in our brain communicating to get those muscles moving, if you're not engaging them and practicing those pathways, you'll lose that quicker. So where strengthening was not something in years past we really focused on as much with a lot of our neurological populations, we are now finding that especially early on, the more strengthening we can do with these folks, we are able to prolong their independence because they're, you know, just like anything else we talked about with the balance, the more you practice that and the more you keep it going, the longer you can have those abilities for. Strategies to prevent freezing, kind of as we talked about before, stepping over is one of the most common methodologies. That's a big one because that's where, like I said, people want to push or pull you, and we don't want to do that. There it is here. Musical rhythms are another thing that work really well. You know, so practicing walking at home. That's often part of your home exercise, is to get a song with a good beat that you can practice walking to, so that as you get somewhere stuck in your head, your caregiver, your helper can cue you with that rhythm, can help you get going again. Staying fit and flexible overall, so that again, we don't have as much rigidity, the muscles are prepared for what we're wanting them to do. And again, no pushing or pulling. We want to help in the best way we can. The shakes, as some people refer to it, which is that tremor that a lot of times we see, that certain 4 to 6 beat tremor. Again, we're now seeing that folks who've worked with the strengthening, especially early on, are actually preventing some of that tremor and not seeing it as much or as frequently, which is another reason we've gone in the direction of more strengthening. Some of the best forms of exercise that can keep your brain and your body accustomed to more fluid movement are going to be the treadmill early on when you're able to do it, or later on if you have access to a facility that has the underwater treadmill is a great option. Biking, because again it keeps that constant fluid movement, or swimming laps, which especially moving forward, swimming laps again, the water provides no risk of fall for you. Buoyancy, it gives you nice full range of motion and stretching with the water's help. So it's one of the really great things. And I like seeing the women having fun. PT recommendations, just other things that we often end up talking about. Through all the different stages of the disease process, your therapist can make recommendations and should be working with your main neurologist, primary care physician, again, as a team. You really want healthcare providers who want to work and look at the whole picture of what you're going through and what challenges are individual to you. Making sure that you're transferring safely, getting out of bed, getting up from chairs can often be a challenge in a place where people get stuck. So a lot of times it may be identifying the right chair to sit in when you get to a place, asking for a chair with arms as opposed to a regular chair. Possible use of assistive devices. Again, these are not all created equal. We can all go to Walgreens and they have 15 different canes and walkers and whatnot, but you want what's going to be the most stable for where you are at the current time, and what's going to be adjusted for you personally, height-wise, size-wise, for areas you have to turn and maneuver in, the car you're getting in and out of. There are many considerations that just going and getting something off the shelf may not always be the right thing for you. So work with your therapist, with your doctors, to make sure you're getting what you need. And then regular maintenance. This is a big one. A lot of times people will seek therapy when something, when they're first diagnosed, and then possibly as things change and progress. But one of the best ways to maintain your functional level and prolong that independence, as we've talked about, is going in for regular maintenance. If it's been a year and you're still at the same functional level, you can go back to therapy again and get new exercises to maybe challenge you a little bit more. Again, the body becomes accustomed to doing the same things. So even if you've maintained with a certain home exercise program, your body's now used to it, it may not challenge you as much. So don't be afraid to advocate for yourself and say, hey, it's been a year since I've been in therapy. I'd like to go back and see what else they can do for me. And in all of medicine, we're always learning new things ourselves, and new technologies are coming out that it's good to revisit, because we may say, hey, you know what? Since the last time you were here, we've now started trying this with our patients, or we've got a new piece of balance equipment, and it would be great to see how you do on it. You're just waiting for that progression to come. Conclusion. There are many ways that therapy can help those facing Parkinson's disease. It's important to work with your doctor as you progress through the stages and maintain that independence. And a great therapist will communicate with your medical team and ensure that you get the best care warranted wherever it may be.